Mr. Acting Speaker, this is the 33rd health budget that I am speaking on. There have been 11 different health MECs in this province since 1994. This is about 3 years on average. That's how long they last, with many departures due to scandals. The pattern is that every new MEC comes in to clean up the mess of her or his predecessor. You know, we once had a health MEC called Hope Papa. But as they say, hope on its own is not a strategy, and neither is faith. There has been even more chopping and changing with heads of department and chief financial officers. Currently, the HOD is suspended because he failed his lifestyle audit, and we haven't had a permanent CFO since the last one was suspended because of the Tembisa looting, and then she left after receiving a secret payoff. The former MEC, let's be honest, presided over several disasters while proclaiming a fantasy of real progress. So, Madam MEC, I'm going to give you a chance. You can make a real difference if you embrace honesty about what is wrong with the Gauteng public health system and what it will take to fix it. You know, the budget says the right things. You've said the right things. They just have to be implemented. Let's take priority 5. It talks about improving the quality of public health services. An important promise is made that all critical and SMS positions will be filled in all institutions, including all hospital CEO positions. You know, I really hope the Honourable MEC delivers on this. As 13 out of our 37 hospitals are currently run by acting CEOs, 1 in 3 hospitals. In the case of Pholosong, wait for it, it's not had a permanent CEO for 5 years. Can you imagine a hospital without CEO for 5 years? And this is another broken promise by Premier Panyaza Lesufi, because she pledged 5 years ago to fill all hospital CEO posts by December 2021. Another broken promise to the detriment of the patients of our province. You know, leadership is key, Madam MEC. If you had crooked or incompetent CEOs, you get a Tembisa looting disaster and hospital horror stories. 2 years ago, the Auditor General notified the department that the CEO appointments to Chris Hani Baragwanath, Steve Biko and George Bukhari hospitals were irregular. These CEOs control a total annual budget of more than 10 billion rand. The department justified 2 of these appointments because they were women, even though one of them did not meet the academic and experience requirements for the job. Honourable MEC is about to get the Public Service Commission report. Shortly, it's going to report on these appointments that I suspect is going to be damning. I disagree with the department's target of 55% women in senior management, and I'll tell you why. It is way more important for thousands of women patients that the best possible CEO is appointed to provide them with quality care. And you saw this with the Health Ombuds report on the deplorable CEO of Rahima Musa Mother and Child Hospital, where pregnant women were sleeping on the floor. Now, Honourable MEC, I've said I'm going to give you a chance. Please make sure that another incompetent crony is not appointed to be the new CEO of the Charles Muteka Johannesburg Hospital, which suffered so much from the previous CEO. You're not playing around with that appointment. It's 4 billion rand budget. You've got to put a real, serious, competent person there. And this is why I cannot stress enough the importance of leadership being honest and competent. Otherwise, even the best budget will be spent badly. Let's take priority 7. It's to strengthen health system governance and leadership. I commend the goal to achieve a clean audit by the end of the current term. That really would be an achievement for you, as well as eliminating fraud and corruption and paying 100% of invoices within 30 days. You know, Honourable MEC, this will not happen without tip-top management. You've got to get the best people at all levels. If it's not in place, then you will fail like all previous MECs who made big promises. I've seen all of them make these promises and they've all failed. The Auditor General, wait for this, has warned that this is the only department with non-compliance in all areas due to a lack of an effective control environment. And that's the reason why the 70 billion rand budget, so a huge amount of money, will not significantly alleviate crises like the 30,000 patients waiting for surgery. According to an official reply to questions that I've asked, this can be as long as 10 years for surgery at certain hospitals. Now, I've got a date. One patient showed me the date that Chris Hani Baragwanath Hospital gave her for a knee operation. Just wait for it. She's been told to come back on the 13th of July 2032. 13th, I can't even, conceive of being told to come back, in July 2032, and then you'll probably be told that it's been cancelled and you have to come back in another few years' time. This is the scandal that we're dealing with here. So, Madam MEC, one area you can make an immediate difference is to withdraw the department's court case against the Cancer Alliance, TAC, in Section 27. Unlike the former MEC, you don't need to defend the indefensible, such as the failure to spend 250 million rand budgeted for radiation treatment. You can disclose the hundreds of cancer patients who suffered and lost their lives because of this. I found it refreshing in a recent official reply. You admitted that various delays seriously compromise cancer care. Official reply at Gauteng Johannesburg Hospital, including reduced chances of survival. This honest recognition of deficiencies in cancer treatment should lead to better management of the budget to include quality care for cancer patients. Now, Madam MEC, you also need to get a grip on disastrous building projects with ludicrous delays and budget overruns. And I'm glad you listed them, actually. Because the Honourable Premier promised that the Johannesburg Forensic Pathology Centre would be complete in December 2024, note, and this year he again promised it would be done. Can you believe that this forensic pathology laboratory was supposed to be finished 7 years ago? 7 years ago, at a cost of 588 million rand. And you know what the story is now? It's about 800 million rand. And it's a similar story with the fire-damaged areas at Gauteng and the Tembisa Hospital, as well as the Randfontein and Pholosong clinics. Now, Madam MEC, this budget also needs to ensure the following: emergency ambulances that arrive speedily, no equipment and supply shortages at hospitals and clinics, a health information system that eliminates paper files and long queues, as you said, one patient, one record. If you achieved that, you would be my hero, to be honest. I've heard it for so long, going back to the first MEC, Honourable Amos Masondo, who said that he was going to have a health information system. And then you need enough beds for mental health patients to be treated with dignity, and the child vaccination rate should be close to 100% instead of 75%. Now, I hate to tell you, the DA opposes the Gauteng Health Budget, as we have little confidence it will be spent effectively and efficiently to maximise the health outcomes of patients. We're talking about people who want to be free of pain. They want to regain their sight, their hearing, and they want to live to enjoy their grandchildren. If the DA was in power, we would follow the model of the Western Cape Health Department, which has had 7 clean audits in a row. They managed to do it, you can do it.